Hey, welcome to Social Security for Agents Part 2. Today I'm going to talk about one of my favorite topics, and that is the other side of Social Security that most people don't know about because it's not common knowledge or mainstream. So, the second program that Social Security administers, in addition to regular disability, retirement, survivor's disability, is the Supplemental Security Income, formerly known as SSI, not to be confused with SSDI. SSI stands for Supplemental Security Income. It's Title 16 of the Social Security Act. Now, Social Security administers this program. It's not based off of taxes paid into work like regular disability, retirement, and survivor's benefits. It's funded by taxpayers' money. However, it's for people who are uninsured, underinsured, or extremely low income for 65 and up. And it follows the Medicaid guidelines for income and assets. For assets, usually they exclude the house that you own and one vehicle. And they also exclude the loan of a vehicle. So if you just bought a car yesterday and you have a car note, the loan is excluded on that. So SSI, it's needs-based. And when Social Security determines if someone qualifies for SSI under the age of 65, it's based off of, are they insured for regular disability under the age of 65? And insured means, do they have enough work credits in the 10 years before they became disabled based on their date of onset and date last insured? We'll go into those terminologies in a different class, but if someone is not insured for disability, they could still have 40 work credits, but you have to have enough work credits right before you become disabled to be currently insured. So let's say I stopped working in 2019, maybe because I was taking care of somebody, or I won the lottery, or I was just living off my savings. Well, you usually become uninsured about 5 years after you stop working. So this would be like the 5th year, 2024, right? Let's say in 2026, I get sick, I get cancer, or I have a car accident or something. At that time, I would be uninsured for disability despite having my 40 credits. So what that means is I wouldn't qualify for SSDI. I could only potentially qualify for SSI based off of other income, resources, and assets. So that's a lot of times people who qualify for SSI disability, it's not because they didn't work. It's usually because they didn't get approved for disability before their date last insured expired. And that happens all the time, especially when people have to reapply for disability. If they don't appeal the original disability determination and they just apply brand new and keep restarting the cycle, a lot of times, especially with common disabilities like back issues and stuff, that's really hard to get approved for disability. And sometimes people just lose their insurability if they don't prove that they're disabled before the date last insured. So people who qualify for SSI, it's not necessarily that they didn't work. It's that they didn't work close enough to their date last insured. Another scenario is if someone is underinsured. I used that term before. So if someone's Social Security disability check is under the $943 federal limit for SSI with the $20 exclusion, so $963, they can potentially get, based off income, resources, and assets, other income too, they could get the difference. So for example, I use this example a lot. My little sister, she's a disabled adult child. We'll talk about that in a future lesson. She gets $500 a month on Title II, regular disability. And the difference is made up on SSI because she's below the federal poverty limit. So it's meant to bring her up to the federal poverty limit. So she gets 2 checks, one on the first, SSI, one on the third, regular disability. One of the most important aspects of the SSI program is $1 on SSI qualifies someone for SSI Medicaid, which is different than Medicare Savings Program. SSI Medicaid is administered by Social Security and the state, but it follows the person state to state. So if they are approved for disability or benefits for over 65, and they start in one state, a simple address change with Social Security on the SSI record moves their Medicaid to their new state. They don't have to go through the jumps and hoops of applying for Medicaid in the new state and thinking they might not get approved, as many people who are on SSI have unstable housing, so moving can be quite frequent. This also entitles someone to, at the age of 65, the day before someone's 65th birthday, if they're not disabled, but they are still under the income of $963 federally and under the asset limit of $2,000 in assets, they may qualify for a program called SSI Aged. SSI Aged does not require the disability. It just still has the income and resource limitations and citizenship or protected lawful aliens. One of the perks when someone files for SSI Aged is they first have to apply for any other entitlement, as SSI is a needs-based program of last resorts. So if they haven't taken their own retirement, widow's benefits, VA benefits, pensions, they have to file for their other entitlements before SSI can be determined. So how much money can someone get? First, the disclosure is it's not an insurance agent's job or anybody else's job for that matter to determine someone's eligibility. We should simply refer someone over to Social Security's local office for them to make a determination if someone qualifies. Our job is to simply recognize a possible referral. So if someone's Social Security retirement is less than $943 single with a $20 exclusion, I'm going to share with you a state resource guide where you can determine some extra states. Now, always refer to SSI for them to qualify for this. So this resource makes it really easy to skip around and find the state information. It has a chart that has clickable links for extra SSI charts. So let's say we click on California, we're going to find the SSI Supplemental Security Income in California, and they have a beautiful chart here that shows exactly how much someone gets. Now, SSI has different living arrangements. If someone lives in their own household, they get the full amount. However, if someone lives in a different household and does not contribute to any of the household expenses, such as rent or food, they're charged what they call in-kind substance, in-kind support and maintenance. So they don't get the full amount if they are living in someone else's household and not contributing. Maybe they're sleeping on the couch or something like that. If someone is blind, they get more, a lot more. You see this down here, the 2,248. I could potentially get that. So I always refer everybody to Social Security for them to make the determination on the household living arrangement and what they would get from the potential state. Now, some people, they might not know that they have to change their address, but it's important because the Medicaid follows them. So you don't want to move to Georgia and still have New York Medicaid because it's not going to cover you except for an emergency. So I always tell people, make sure you update your address, especially if you're going to be out of the state for 30 days or longer, because the Medicaid is really important. So in California, these are the fact sheets. Sorry, my screen wasn't showing, but you could see here that someone can get different amounts depending on their living arrangement. So living in a different household, not paying their full fair share, they get charged in-kind support and maintenance. Minor child with a disability, and a minor child with living in someone else's household, and then blind gets much different rates. So this is California. In the great state of Nevada, it's a little simpler. And it has to be coded like this, and only the state Social Security office that is in that state is really proficient in coding it. Once again, you have to have your mailing address and your living address coded to the state, but it's possible to get extra money, because I was really confused. I was like, well, how do they expect her to pay that when her Social Security check isn't that much? Because she was only at one time only getting the extra $87 from the regular state supplement. And the residential program told us about the congregate care, and it was really eye-opening. So I wanted to show this to you guys. Like I said, you don't need to memorize this, but just know that it exists, that people who live in congregate care in the great state of New York could potentially get a lot more income to meet the needs of, their share of the room and board. If you ever encounter someone who has Part B only, the very first question you should ask them is, what day do you get your check? Because they might already be entitled to this program, as Part B only signifies that they don't have Part A, usually because they don't have 40 credits. So if they have Part B only, I bet you that they already have SSI, because you can't buy Part B before 65 if you're not insured. So they probably do have SSI age with Part B only. Some states will allow them to, the state will pay for the Part A. In some states like California, it's pretty easy. Colorado is pretty easy. It's called conditional buy-in. It's not the easiest thing to do, and I recommend doing charity after hours because it's tedious, and sometimes they get upset and bounce from office to office because it's not a frequently used term or program. A lot of Social Security employees might not know what you're talking about, or they say that the state does it. But that's how you would get someone to get Part A and SSI, is if the state agrees to pay for it. Now, it's pretty expensive. Now, there's a big misconception that someone who qualifies for SSI, disability, or aged didn't work, and that's simply not true. You can qualify for SSI, disability, or age and have 40 work credits, or have been uninsured because you became disabled after your date of last insurability. Oftentimes, people who qualify for SSI, it's because they were an unskilled worker making, low wages in the United States. My mom was a CNA who worked for 40 years after, putting kids through school. But she was only making like $10 an hour at the nursing home. And that usually equates to pretty low wages. So it's not that someone is not a worker, it's that their wages were really low. The program might also help someone who came to the U.S. later in life and either became a citizen or they qualified as one of the qualifying legal residents that we have. And I'll show you the policy in shortly. But a lot of people, there's a misconception in public that people who get a check on the first, it's welfare, and it is federal welfare, but it's not that they didn't work and pay into the system. It's that their wages were simply really low. So Social Security calls foreign-born residents as aliens. That's the formal terminology. They're not talking about ET. But there are some what they call qualified aliens who can be eligible for SSI. And there's many policies, but these are just a few. They receive SSI for a maximum of 7 years from the date Department of Homeland Security granted you immigration status of one of the following categories, and the status was granted within 7 years of filing for SSI. Refugee under Section 207, asylee under Section 208, an alien whose deportation was withheld or whose removal is withheld under Section 241, Cuban or Haitian Asian immigrant. Cuban and Haitian entrant is actually a pretty large population in Florida because of their what's going on in their country. One of the unique features of the SSI disability program, unlike the regular disability program, is regular disability has a 5-month waiting period. Even if the worst of the worst has happened to you, you still have to wait 5 months unless you have ALS. That's the only precursor where don't. But SSI program, DI 11055.231, they have a regulation called presumptive disability. And this was one of my favorite things to do at Social Security as a disability claims specialist specializing in SSI is you have to listen clearly and be thorough in your interview. But there's some disabilities that qualify for an immediate presumptive approval pending the state's final approval. Amputation of a leg at the hip, allegation of total deafness, allegation of total blindness, allegation of a stroke more than 3 months in the past and continued marked difficulty in walking or using a hand or arm. This was one of my most frequently used ones. When someone said, I have a stroke and that's why I'm disabled today, I had to ask, how long ago have you had this stroke? Do you have more difficulties using your arms and legs and walking? Allegation of cerebral palsy, muscular dystrophy, muscular atrophy, and marked difficulty in walking, such as the use of braces, speaking, or coordination of hands or arms. HIV or AIDS, and there's specific forms for the HIV and AIDS. Doctors, they have to fill them out, and it's not just HIV or AIDS. They have to have several conditions for that. Physician confirms by phone or a signed statement that an individual has a terminal illness with a life expectancy of 6 months or less, or a physician or a hospital official, coordinator, staff nurse, or social worker confirms that an individual is receiving hospice service because of a terminal illness. They can also receive SSI. And again, that comes with immediate Medicaid for the next month. So if someone applied on June 29th for SSI disability, and there was a presumptive decision made because of one of these, July 1st, they would have not only a check, but full Medicaid in that state. Allegation of spinal cord injury producing an inability to move without the use of a walker or bilateral handheld assistive devices for more than 2 weeks. End-stage renal disease requiring chronic dialysis. So let's say someone is applying for Medicare and applying for disability. The ESRD Medicare gets approved regardless of disability approval. It's a standalone. But let's say they're waiting for the disability check and it's at the state, they can get SSI in the meantime, giving them full Medicaid and a temporary income of up to the $943 for a single person while the state is working on their disability claim for regular SSDI. That's massive. Allegation of ALS, known as Lou Gehrig's, allegation of bed confinement and immobility without a wheelchair, walker, or crutches due to a long-standing condition. This excludes a recent accident. So it's only for like a sickness, not an accident or a recent accident or surgery. So this is the presumptive benefits. Now, presumptive benefits only apply to SSI. Now, all our Social Security programs, whether it's disability, retirement, survivors, SSI, Medicare, everything is regulated by the Program Operations Manual System, formerly known as POMS. And POMS has a policy for everything you can think of. So I'm going to show you how just SSI eligibility policy is. So we're starting here in 501. So you see that there is a policy for everything from SSI eligibility for students abroad, blind or disabled children or military personnel, SSI alien eligibility. There's over a dozen policies, right? Keeps going and going and going. Requirements to file for other programs. Access to financial institutions. So Social Security verifies their financial assets in institutions. It's a query. Under permission, we had to verify. When I worked for Social Security, we had to verify their income and assets, and bank accounts as an asset. And I can sometimes see like 30 bank accounts in someone's name. So it's one of the things they verify. Institutionalization. One of the policies for institutionalization is if someone is married or a child, when they're in an institution, the other household income doesn't count against them. So if someone has a child, let's say the child is a newborn and the baby is in the NICU at the hospital, their parents' income doesn't qualify or count towards that child's eligibility. So a lot of times, especially low birth weight babies, they would qualify for SSI while they were in a hospital and they got the Medicaid. And the same thing for a disabled adult if they were married, however, and typically would be over the income. If that person is institutionalized for 30 days or more at a facility like a nursing home, the spouse's income doesn't count. And that can help some people qualify for benefits. And so the living arrangement is really important part of the SSI program. But these policies go on and on. Fugitive felons, we had to make sure that someone wasn't incarcerated or a fugitive felon, or we couldn't pay benefits because we can't pay benefits when you're in jail. And this is just the eligibility. And so I always recommend people, if you have a question about something, you can simply type into Google SSA POMS plus the keyword. So one of the biggest questions I get is income. And this policy, again, is very extensive. So you can't expect someone to know everything. They usually do have to look it up. So here is income exclusions is a common one. And one thing that I would like to bring to attention is just because it's not taxable doesn't mean it's not countable for the SSI program. Veteran benefits is one of those. Veteran disability is not taxable, but it is certainly countable for SSI needs-based program. I have so many different policies here. You can explore this on your own, but this is where you would go to look up someone's question. You don't want to have them call in. And then deeming will tell you, deeming is the term that they use to determine someone else's income and how it affects them. So a spouse to spouse, since SSI is a needs-based program, they would say the spouse's income deems to them to determine the actual qualification. Or if it's parents with the disabled minor children in the house, they would say the parent's income is deemed to the children. That's what the deeming means. So they have to determine how much the parents are making and how many children are in the household to determine how much of the income the child is due, if at all. And then, SSI is like based off of resources too. So a lot of the questions is somebody might qualify by income, but if they have 20 different cars, they're not going to qualify by resources. And that's not something that insurance agents should determine. We should always refer somebody who might be eligible to the government for them to get a formal decision in writing, because sometimes resources change, especially if they, spend down their resources appropriately. I always say don't give anything away, because there is an exclusion if they give away assets, that they're penalized and they can't apply for certain many years. But I always refer somebody to the government if I think they might qualify off of age, disability, and resources, and just age and income and resources if they're over the age of 65. So if someone is under 963, the big takeaway, especially in the Medicare market, is to make sure you refer them to the SSI program. They're under making less than 963, and let SSI determine their income and assets that are countable. And if they can get $1 on Medicare, $1 on SSI gets them full Medicaid through SSI, so they don't have to go through the recertification every year, the Medicare Savings Program, reapply every time they move states. That's one of the biggest benefits, is the SSI program. The Medicaid just continues. As long as they get a check, they get Medicaid through that program. I hope this helps everybody today. I enjoyed our session. If you have any questions, please put them in the chat. I will see you next week.
That's a wrap. If this helped you close more deals, hit follow. New agent training drops every week only on Top Flight Insurance.